Patients with multiple sclerosis are finding relief with a new treatment, but not everyone in the medical community is so sure about it yet. In tonight's 9 p.m. Extra, we're going to show you why a Tucson man, though, is 100% behind it.
About 3 years ago, I developed some loss of dexterity in my left hand and also a left leg foot drop.
Add in vision problems and low energy, and what Ryan Noreen has is multiple sclerosis, an autoimmune disease affecting the brain and spinal cord, resulting in loss of vision, muscle control, and balance.
Whenever I get time, I go down to the gym, and I think that's one of the things that's really helped me.
Exercise and medication help Ryan treat his disease, but the Tucson resident decided to add another treatment to the mix.
I was hoping that, you know, there would be, if anything, just one positive benefit from the surgery.
Ryan had a minimally invasive procedure to unblock veins in the neck, restricting blood flow out of the brain. A new theory by Italian doctor Paolo Zamboni says these blocked veins create iron deposits and lesions that cause symptoms of MS.
Traditionally, MS has always been thought of as an autoimmune disorder, but now it's hypothesized that this vascular problem contributes to MS and these plaque buildups.
Dr. Matthew Namani is a vascular surgeon in Tucson. He and another colleague have performed more than 100 procedures.
We treat them with a balloon venoplasty, meaning we put a balloon inside that abnormality, inflate it, and reopen up that vein to allow improved venous outflow.
But not everyone's a candidate. Ryan turned to Arizona Doppler specialists. They're part of a small group of technologists across the country trained to screen for these vascular issues.
I did all the readings of the proper Zamboni protocol, and it's very difficult. It's a different way of looking at the way blood flows through veins. And what they are is blood flowing in the wrong direction of the jugular veins, blood flowing the wrong direction inside some of the veins intracranially.
Ryan's had 3 procedures in more than a year.
I noticed after the 3rd surgery that my vision was better. And that I had more energy.
But not everyone in the medical community is behind the theory.
It would be wonderful if it shed some new insight into what causes MS. At this point, I think our level of knowledge about it is not high enough that I would send one of my patients off to have the procedure done. I would want to see more data.
It's still a hypothesis at this point, but I'm hoping, crossing my fingers, that someday the research is done and that it does become shown to be a cure.
And the national MS societies in the U.S. and Canada are funding several research projects to look into Dr. Zamboni's theory. For more information, log on to azfamily.com.